Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Hey everyone, this is Bradley Bostic, host of Boombostic Health. Today we're going to tackle a really interesting topic, which is about electronic health records and one of their major limitations, which is that they can create a complex barrier when communicating with outside parties, in particular all these diagnostic entities that are separate from whatever the institution is, the health system or clinic that actually owns the EHR. And my guest today, Greg Stein, is CEO of a really cool company called Shadowbox that's tackling this issue in a very, very interesting, innovative way. Welcome to the show, Greg.
Hey, Bradley. Thanks for having me on. I'm excited to be here.
Absolutely. So just to do a quick introduction, we get a chance to talk to some fascinating people on the show here. Greg is one of those people. He's a great innovator, healthcare entrepreneur who's been in the industry for quite a while. And prior to getting into Shadowbox, it actually scaled a lab business that did medication monitoring and really took that to another level. And Greg, I'd love to just have you give a quick intro and maybe just tell a bit of the story on how you ended up doing what you're doing now and why you're passionate about healthcare.
Happy to do so. And quite frankly, your lead into your podcast where you say the business of healthcare is broken is exactly what motivated me to do what we're doing at Shadowbox. So I was an executive at what became a very large independent diagnostic lab. We were doing hundreds and hundreds of traditional HL7 type integrations between our ordering clinics and our laboratory information management system and spending a lot of money on it. And the challenge there was really multifold. Number one, it took a long time. It could take 3 months, 6 months, a year even sometimes to get that integration up and running. And number two is when we get that integration up and running, the volume of orders may or may not have been what we would have expected when we initially greenlit that expensive, lengthy integration process. Sort of the third situation would happen is that we get a lot of orders in, but we didn't have the contracts with the payers in a way that those orders actually proved to be financially viable. And so we're investing a lot of money in this process and not getting a significant enough return on it. And by the way, we were also still receiving faxes by the thousands with all the challenges related to that. And for all those practices where it just didn't pencil out for us to even greenlight the traditional integration. And so the idea was, and we weren't the only one to have this idea, was to create a user portal. So the clinician would be in their EHR, they'd want to order a lab test from us. They would swivel chair to a new URL, log in, and they had this beautiful site where they could enter in all of the important information, the patient information and the ICD-10 codes and all the things they needed to do to order a lab test. But then we were seeing an adoption rate issue. Keystroke error. I don't want to swivel chair between this and another portal. And then everybody had a portal. And so then they were asked to swivel chair between 5 or 10 different portals and actually leave their EHR, leave their workflow, get disrupted. And so the really fundamental idea that we had was, what if you had the EHR open on one side of the screen and the portal open on the other side of the screen, sort of like you and I are on this screen right now. And with a click of an easy button, it would extract the important, correct, accurate, discrete data that lives in the EHR and move it into an ordering process in the portal so that you didn't have keystroke error, so that you didn't have missing information, and you could more rapidly and quickly and effectively order a lab test. That was the initial idea. And I was able to identify some really smart engineers, and we actually have built exactly that. It's an easy button for ordering diagnostics. And so that was the idea. And we could talk more about this as we go forward as to how powerful that is as a tool. But today we have many, many laboratory customers that do a one-time integration with Shadowbox on the back end with their LIMS and Shadowbox. They're able to go into a practice in the morning using, say, Athena EHR and install within a few minutes and up and running. And they're able to order literally within a few minutes with no marginal cost. They go to that same sales rep can be in the eClinical using Clinic in the middle of the day, once again, set it up. And a Practice Fusion at the end of the day, they've got 3 practices up and running using 3 different EHRs, no marginal cost to get those set up. And they're good to go or getting clean, complete orders in the door right away. And the data that we have on the back end, we could talk more about, it's incredibly compelling as to how valuable that is for our laboratory customers.
That's awesome. Well, that's a lot. One of the things that jumped out at me when you were talking is you said the word faxes, and some of our listeners might not even know what a fax machine is. but it's pretty remarkable that there are a lot of healthcare organizations that still fax reports around. And part of that is because it's hard to do the integration, right? That if you have an electronic health record and you want to actually integrate so it is more of a transfer electronically from one system to the other, you have to do technology work that requires IT resource. And those IT resources never have extra time. They're usually working off of a list that's like 3 years long. And so to prioritize some project to order a diagnostic test from somewhere else, even if that diagnostics provider has some unique test that could be better for the patient, it's just hard to be able to prioritize that. And so what I'm hearing you say is the approach that can be used is these electronic health records have already offered or are currently offering an option where instead of logging into their standard user interface, which goes through a browser, you can actually set it up to have another browser log in using that same type of authentication. But then within that browser that you have set up, there's like an ordering function for these diagnostics. So it's just like going to like a different tab on your browser. Is that how that works?
It's even easier than that, but fundamentally you're correct. You install a Shadowbox powered browser, which is white labeled for our customers today. So it'll be Lab XYZ. And rather than going into that same EHR that clinic uses every day, they go in through the Shadowbox powered browser. And so our proprietary tech and what we patented is once they log in, they're in the EHR they use every single day. There's a little easy button. So they're still within their EHR. And when they click the easy button, it just slides the screen to one side and opens the ordering portal or an ordering form. And so they never actually leave their EHR. They're still in there. And then that creates a secondary opportunity in that as the order gets created, they're able to look at the chart simultaneously and actually do a quick validation that the data is in there is complete. So for example, you might have a list of ICD-10s in your patient chart, and those port over automatically, but you may say to yourself, wait a minute, there's a ICD-10 that's specific for this particular test that I need, and it isn't recorded in the chart. I can select that, or I can add that. And so there's some validation that goes on there. And the data, and I mentioned our case study. We did a case study last year with one of our laboratory customers. Over the course of a year, 25,000 plus transactions. They installed Shadowbox in over 50 locations using 13 different EHRs, all with that same backend, the same user experience. And they saw a 20% reduction in denials by payers due to medical necessity. That's because you're getting clean, complete, accurate data with the appropriate ask and order entry questions that are necessary for that particular test every time before the order is sent. Number two, 13% increase in net revenue versus non-Shadowbox orders. Why is that? Because they're not missing those windows for appeal because there's fewer denials. They are getting good complete orders in the door so their DSO is going down. And because they are able to, when there is information, they're not bugging the practice as nearly as much because they're getting so much better information on the front end. And so whereas there's massive pressure on the top end to reduce reimbursements for labs, so we're seeing non-Shadowbox orders, lots of pressure, their revenue is going down, but Shadowbox orders, because of the quality of the order, revenue is actually going up. And that was a net 13% increase. So what we're seeing is a significant value, not just for the laboratories, but also for the clinics themselves who are having to deal with many, many things during the day. They don't want to get interrupted by a laboratory trying to get additional information just so the lab can get paid.
Got it. So I understand all of that. That's a lot of lab specific information. Does this apply to any kind of diagnostic, or could it or should it? Like
Yeah, absolutely.
radiology, for example.
Absolutely. So the basic workflow between a system, between a clinic and its specialists or outside providers, whether they're diagnostics or not, is relatively standardized. Meaning you have information in EHR, you have a desire to achieve a service for something that you don't provide within your four walls. And you need to send a referral, you need to make an order. And that can be done either through a traditional integration where it's a drop down in the EHR. It can be done with a fax, which is usually what's happening these days, or you could do it through a Shadowbox ordering process. And so we have a number of customers that are in the imaging space as well. And we are expecting that over time, that will continue to grow as other modalities identify the value of the Shadowbox platform.
So to really talk about this in bigger picture terms, it's about bringing the right diagnostics to the physician and their patient, wherever those need to be coming from. And this can give you this ability to have a switch that wherever is the best test. And I'll use an example. You might have somebody who has, say, non-small cell lung cancer who needs an NGS, next generation sequencing kind of test in order to really zoom in on what is the biomarker, what are the biomarkers that relate to the best treatment for this, which is more of a precision medicine use case. That could be an example, it sounds like, where it might be a specialized lab that does that work that you might not have in-house. And with this type of an approach, you could actually have access to that test, which is the best for the patient, without disrupting the workflow for the physician, which is a big impediment in healthcare. If it takes extra clicks, extra time, sometimes people just decide not to do it because they don't have the time.
You're exactly right. In fact, a number of our customers are exactly those laboratories providing exactly those types of tests. And to zoom back out, the problem of we'll call it interoperability, but in the part of it that we're tackling is really around the disconnect between what is being used within an environment like an EHR and a hospital system has lots and lots of services and things that are attached to it. But that's not our target today. Our target is the things that are between the EHR or the clinic and the things that are outside of the services that are already provided and available within the EHR to make that extremely simple for them to access. And recent testimony on Capitol Hill says that overall, these manual workflows, the lack of connectivity, the rework that's associated with it, the challenges related to prior auths because of the lack of good data going into the ordering process, all of that is about a $950 billion problem. And so whereas we're tackling primarily laboratories and imaging centers and others that are on the diagnostic space, there is a much broader universe of activity that can be addressed through this exact same platform.
Got it. That makes sense. So switching gears a little bit, you are in the San Diego area, right? Which is a beautiful part of the country, beautiful part of the world. And there's a lot of biotech down there, a lot of pharma activity, and a lot of research is happening in those areas. Are you seeing any research related use cases that tie into this idea of being able to connect to external diagnostics, or is it really all clinical at this point related to more customary care delivery?
Actually, I think that there is an amazing opportunity that we've been exploring around research. And that is that because Shadowbox can access discrete information within the EHR, we can essentially crowdsource potential remnant specimens or patients who fit a certain pharma requirement for either a clinical trial or some other research that they're doing, and actually flag that patient as or their specimen as a potential. If it's a specimen, a de-identified specimen that is specific though to the demographics, you're looking for, maybe a female over age 50 with this ICD-10 code, right? And maybe even a racial, makeup. And now it's flagged. You can crowdsource that because we're getting transactions, orders for labs across, literally thousands of locations. And then if that's in terms of like doing the de-identified remnant specimen testing to support some pharma effort. But once they actually are doing the clinical trial section, they're phase 3, they're doing clinical trials, they need participants. Another way to flag that is that same person could flag in when an order comes up to even pop up and say, you've been identified as a potential participant in a clinical trial based upon your patient's data or data, something simplified. Here is a consent form to have the organization contact you to enroll you in that clinical trial. As just one example of how the power of having that footprint can be much more magnified over time. We haven't built that yet, but the fact that we can do that is enabled simply by the tech that we have.
Yeah, so it's about bringing the right care to the right patient with an optimal diagnosis. Ideally, that's proactive and preventative, and certainly is an area of healthcare that has been a key part of my career, just focusing on how can you boost outcomes, how can you make the economics better for healthcare, and how can you more efficiently connect all these different parties. So also with San Diego, that's where Anchorman was actually based, right? Isn't that where Ron
Absolutely.
Burgundy was?
Yes.
Yeah, and So do you guys have a news station like that?
I will not comment on that because I'm friends with several of the folks at these various news stations, and they may like the idea of being affiliated or associated with it, but not the actual output.
All right. Well, I won't quote what he says San Diego means, but I will say the part about diversity being an old wooden ship is a pretty funny line. So very classic movie for any of the viewers here that have not seen Anchorman or haven't seen it within the last year. I would definitely see it again. It's incredibly funny and full of one-liners and nothing at all to do with solving healthcare, but worth bringing up. So another item I didn't want to leave unsaid is that you have become really passionate about or have been passionate about certain services for the community. And you're part of this group called Safe Homes Coalition that relates to combating the prescription drug abuse epidemic. Could you talk to that a little bit? Because it's obviously relevant to this idea of helping with people's healthcare.
Sure. So my interest in public service and public health goes back many, many years. In fact, my first real job was as a actually assistance manager and legislative aide on Capitol Hill for a couple of different congressmen. And I was fortunate enough in those roles to be able to participate as a small cog in the machine in helping drive innovative solutions to large scale problems. The legislation that I'm most excited or proud about then really led to what I'm doing today in a sort of roundabout way was the Telecom Reform Act. And at the time, we had legislation and regulation that was based on when there were 3 TV stations and fireside chats by FDR on the radio, and not for a world that was rapidly going digital and rapidly expanding into wireless and these other modalities for really driving information age, and getting together with incredibly innovative entrepreneurs to think about how the world could be if you just set the stage in a way that enabled them to accomplish what they wanted to accomplish, or even just try it. It became really fundamental to who when I became a district director, which is sort of a district chief of staff for a congressman here in San Diego. I had an opportunity to meet legislators, regulators, and entrepreneurs, and the entrepreneurs were the ones who were solving these major problems in real time. And it was in the telecom industry, in biotech, as we've already talked about. Actually, the Navy's advanced technology flag is here in San Diego. Software technology, Qualcomm, the wireless giant. All of these entrepreneurs were solving big problems in real time. And that inspired me to do something different and inspired me to continue to. I've always wanted to start my own things, and I could get more into all the various things I've started along the way. But when I was at the large diagnostic lab doing medication monitoring, I ran across a public health organization that was trying to educate individuals and families about the appropriate storage of medications that were in the home. And by that, it's based upon data collected by the government that represents that a very significant number of the medications that are misused or abused come out of a medicine cabinet. Could be a grandparent, could be a neighbor, could be a family member. They're prescribed some medication either for behavioral health or for chronic pain or what have you. And those medications have a street value. And so we partnered with that organization and realtor associations actually to educate families about the idea that if they're opening their home for any reason, whether it's a dinner party, an open house because they're selling, or just having the kids' friends over, that they lock up those medications and secure them the same way they would their passports, their jewelry, their cash. And we did programs for several years across the country and from Boston to San Diego. In fact, I did an event with the governor of Massachusetts, and where we announced this, and we had the Realtor Association distributing 10,000 bags, and the bags were informative about securing medications, about where to dispose of the medications, and so on. And unfortunately, I'm no longer involved. Given that I'm doing the Shadowbox thing and it's taken up so much time, but it's truly an important issue as we address the opioid epidemic that's still ongoing.
Yeah, it's fascinating. Well, I've had a fair amount of exposure and experience in that space too. And there's a lot of work that still needs to be done. Pardon me while I snack a little bit. I skipped lunch. So, you got to fit it in when you can. Well, thanks for that overview and, for putting your energy into talking about the work you're doing at Shadowbox and where that can go. It seems like it's this description that you provide is the starting point of a bigger picture set of connections. And there's also this concept of health information exchanges. So I think a lot of times people hear about one type of interoperability or data exchange or connections, and it just gets confusing. And I think if you don't live it every day, which everybody in healthcare is exposed to this concept of communication between systems and integration. But most people, unless they're like an IT or they're a vendor that does these things all the time, it's just like over their head about what is all this different stuff. Like, is there any way you can help frame the different buckets of, you've got HIEs, you've got more like native HL7 integrations, you've got the EHR level connections, Epic and Cerner, they market their own kinds of ways to exchange data. And I know that alone could be an entire podcast episode, but I was just reflecting on your initial overview where you talked about HL7, you talked about what you're doing, maybe just framing what those different areas are and how this should be categorized. And then like, do you think the killer app for how all of this gets solved, if there is one? Because every time something new comes out, it's supposed to be whatever that killer app is.
It's an excellent question and an important one, Bradley, because so far, for the most part, when people talk about integration or interoperability, it's perceived as an IT or a tech problem. And the reality is that interoperability or integration is a methodology or a tool to provide better clinical care faster at lower cost. And so I believe that it's incredibly important that we elevate the conversation from an IT conversation to one about a strategic conversation. How are organizations going to get the data they need to do the best clinical care for their patients on the individual personalized basis at the lowest possible cost? The healthcare industry, despite the 17 trillion or whatever that we spend on it every year, maybe that's not the right number, but it's massive, is broken. As you've written, the business of healthcare is broken and it's not getting any better. And so when I think about framing interoperability, I think about multiple levels. I think about the federal government's massive investments in and support of organizations like the ASTP, the Assistant Secretary for Technology Policy, the Office of the National Coordinator, to drive what's called TEFCA, which is the trusted exchange. And those sort of an HIE of HIEs, if I put it into layman's terms, incredibly useful and powerful for the large health systems to be able to transfer data amongst them. And it's all sort of behind the scenes. But where that breaks down is in a couple of different places. It breaks down in the places where you think about specialties, where they don't have the EHR vendor that they're using isn't serving a large enough population where it makes sense for them to make those investments in interoperability that maybe the larger ones, you mentioned Epic and Oracle Cerner. It breaks down there. It breaks down as well in the areas of the community that are not in necessarily the traditional acute care or even specialty care for health, but are adjacent to it, like behavioral health. Now, we talked about the opioid epidemic, but the behavioral health systems, for the most part, are not certified EHRs, meaning they haven't invested in and attested to the requirements about interoperability in a way that at least the larger in the acute care and the healthcare system is. And the third, and probably the largest and yet fully untapped, is in the social services market. The industries like homeless management, information systems, and diabetes care centers, and so on, where they're in the community, they're interacting with individuals, and that data is not coded, it's not structured, and it's certainly not being presented in a way that's consumable by HIEs. So when I think about and frame to answer your question, number one is interoperability is about a strategic deployment of healthcare in a much better way for better outcomes at lower cost. Number two is the systems that are in place today are inadequate for reaching the totality of what's necessary to bring data into a applicable place where it can be actionable. And then number three is that I believe that it's important for those inside the health system and outside, like the diagnostic labs and imaging centers that we serve, for example, today, to have a toolbox to think about interoperabilities. There's no one size fits all. There is no killer app yet that brings it all together. In fact, the large tech companies, Apple, Google, Amazon, they've tried to create a universal health record And they've quite frankly failed at doing that. And so the way we address it and the way we think about it is if you can create a single pane of glass and you could bring in data from wherever that service provider is into a uniform application that can extract the data at the time of a transaction and order a clinical decision, then you're able to, rather than try and create the massive data warehouse where everything's collected, you're actually just accessing the data you need. That data is maintained as its system of record for those providers. And you actually are able to get a much more robust view of a patient's continuum of care than you would trying to go to one HIE or one health system or one EHR.
So there's a lot of investment already in place with these major health systems. There's some HIE concepts, and then there's like the meta HIE that connects all the HIEs if they're certified. And there's also a component of that where when you use one of those HIEs, you contribute back whatever information you have about that patient into the HIE, which opens up some other interesting technology challenges and regulatory challenges as well. And there hasn't really been a good answer for the long tail of all of these healthcare organizations. That's how I would sum up what you just said, that if
Yes.
you're big and you have tons of resources, you have an answer to how you're doing interoperability. But if you're everybody else, which is by far and away more than the big ones, there are thousands or hundreds of thousands of these different entities that need a way to have this exchange of information that's at the patient level, that's secure, that brings the right diagnostic to the patient. And that's what's coming into play here. So that's super helpful. So I also would love to mention that HC1, where I'm CEO, we have recently agreed to a partnership with Shadowbox. Very much looking forward to that. And I think the upside of that is we have hundreds of health systems, thousands of labs that leverage our insights that drive better outcomes, that close gaps in care, and ultimately boost the economics for these healthcare organizations. And we even bring pharma into the picture when we look at that entire health journey and how the lab insights can help power the best possible outcome and be preventative. And this is an area where I think we can build a lot of success together for these healthcare providers that are out there that need a better way to exchange information and that aren't looking for yet another big IT project to do. So we're very much looking forward to that at HC.
As are we. I'm incredibly excited about this. I mean, you take HC1's decades of integration services and you add that to Shadowbox's proprietary and rapid scalable technology that we brought to market, and you layer on top of that your operations management, your insights, your supply chain management, your consulting services, all of the things that HC1 is the best in class on. And now you're creating literally the most comprehensive, the most scalable, the most cost efficient, the most effective solution to help labs, whether they're in a hospital or an independent lab, drive growth, decrease costs, and increase profitability. And we are already just this is a fresh conversation in terms of this partnership, but we're already seeing interest on both your customers and ours as to how we can expand by working with each other. We need to set a mark on our calendar for next year to do another podcast so we could show some of the outcomes related to this. But I'm incredibly excited about it.
Yeah, I think that's great. Let's definitely plan to do that. And if you think about the best way to create products, you should create something that the world needs and that people need and want. And we're seeing these healthcare organizations and payers, they're under so much pressure. In fact, if you just recently saw the quarterly earnings from some of the large payers and some of the more up and comers, it's kind of brutal. That points toward a need to do a better job with how you diagnose patients, to do a better job with how you manage care, to do a better job with how you can connect the dots between diagnostics that are delivered and outcomes that ultimately are achieved. And with this comprehensive end-to-end approach, we have that answer. And so it's exciting to be bringing to market something together that we've heard over and over again. That people need this, they want this. The time is now. And on a more positive note, there's never been a bigger opportunity in healthcare than now to bring the combination of powerful technology. And I have to also mention artificial intelligence, which is the most overused phrase ever at this point. But we've been in the AI space for years. In fact, my first AI startup was way back in like 2005, back way before we had the compute that we have now. Heck, that was even before a full stack cloud native solution was really commonplace. But the pace of change is so fast now, and it's about bringing a strategic value proposition that allows us to leverage agents that comb through and identify those gaps in care, that optimize the diagnostic testing that occurs, that helps to get ahead of the curve so you don't have as many people crashing with chronic kidney disease, for example. We're solving so many big problems already, and together, I think we can do even more. We're very much looking forward to that. And hey, Greg, appreciate having you on the Boombostic Health podcast. Thanks for being a member of the Boombostic Health community. And I will definitely look forward to having you on next year where we can do a recap on how things are going.
That sounds great, Bradley. Thanks again for having me on. Really enjoyed the conversation.
Absolutely. Keep up the great work. All
Thanks.
right, everybody. Thanks again for joining. This is episode 34 of Boombostic Health with Greg Stein from Shadowbox.